Hello students. Hello students. May I,
Yes, ma'am. Good morning. Good afternoon, ma'am.
good afternoon everyone. Only 15 students joined. 4 p.m. हो गया. So I started. Now I will be start. My slides are visible. Hello, hello, student. It is
Yes, ma'am.
visible. Slides
No,
are.
ma'am.
No, ma'am.
Sunanda. ସୁନନ୍ଦା ଦେଖାଯାଉନି କହୁଛନ୍ତି ତ ହଁ ପିପିଟି ଲାଇଟ୍ ସେୟାରିଂ ସେଟା କ୍ଲିକ୍ କଲେ ହେଇଯିବ କହିଲେ ସେଟା କ୍ଲିକ୍ କଲେ ଷ୍ଟପ୍ ସେୟାରିଂ ନାହିଁ
ଆଉ ଥରେ ଷ୍ଟପ୍ କରିକି ଅନ୍ କରିବ ନା?
ହଁ ଏଠି ଗୋଟେ କ୍ଲିକ୍ କଲେ ପଳେଇବ ସେଠିକି ଗଲେ ଦେଖିଦେଲ ଏଇଟା ଏଇ ସ୍ଲାଇଡ୍ଟା ମୁଁ କରିଲି ନାଇଁ ସେଟା ହୁଁ ସରି ସୁନନ୍ଦା କର ହଁ ସେଇଟା ପ୍ରେଜେଣ୍ଟ ନାଓରେ ଏଇଟାକୁ ଏଇଠି ଯୋଉ ଅଛି ତାକୁ କ୍ଲିକ୍ କର
ହ୍ୱାଟ୍ସଆପ୍ରେ ଅନ୍ ଅଛି ନା?
ସୁନନ୍ଦା ପଳେଇଲେ କି
ହଁ
ହଁ ଠିକ୍ ଠାକ୍
ଟିକେ ରୁହ ଆଉ ଥରେ ଅନ୍ କରିଦେଉଛି।
ଏଇଟା ମୋର
କୋଉଟା
ପିଏଲ
କହିଲେ?
ବାଇ ଆଉ ସେଇଟା ଦିଟା ଯାକ ମୁଁ କରିବି ଏଇଟା ଆଗ କରିବି ତାପରେ ଏଇଟା କରିବି ସେଥିପାଇଁ ମୁଁ ସେ ଦିଟାକୁ ଆଣିକି ଏଠି ରଖିଲେ ସେ
ଆଉ ଥରେ କରିଦେଉଛି। ଏଇଟା ନା?
ସେଇଟା ଗୋଟେ ଏଇଟା ହଁ ଏପଟେ ହଁ
Sir, ma'am, good afternoon, ma'am.
ହଁ ଗୁଡ୍
Sir,
ଆଫ୍ଟରନୁନ୍
good afternoon.
ସ୍ଲାଇଡ୍ସ ଆର୍ ଭିଜିବୁଲ
Yes, ma'am, visible.
ଏଇଟା ତ ମୋର ନୁହଁ ବୋଧେ ଦେଖେ ଏଇଟା ବୋଧେ ହଁ ହଁ ଏଇଟା ସରିଲା ଆଉ ଗୋଟାକୁ ଦେଖିବା okay now today topic is critical care unit okay critical
Ma'am, we are
care
not seeing the slide. Not, ma'am, we are not seeing this slide.
okay.
Ma'am, no slide is visible there.
visible
No, ma'am.
ହେଲେ ସେ ଯୋଉ କପ୍ କୁ କ୍ଲିକ୍ କରୁଛେ ସେଟା ନ କରି ସାଇଡ୍ ରୁ ସ୍ଲାଇଡ୍ ଦେଖାଯାଉ ହଁ it is visible now slides are visible
No,
ଏବେ
ma'am.
ନାଇଁ ଦେଖା ଯାଉଛେ ମ୍ୟାମ୍ ଏବେ ନାଇଁ ଦେଖା ଯାଉଛେ ଆଗରୁ ଦେଖା ଯାଉছিল ଯେ ଏବେ ନାଇଁ ଦେଖା ଯାଉଛେ ମ୍ୟାମ୍
ବଢିଆ
पहले देखा जाउଥିଲା अभी नहीं देखा जाउছে ମ୍ୟାମ୍
ଦେଖାଯାଉନି ତାହେଲେ ଆଉ ଗୋଟେ କେମିତି କଣ ସେୟାରିଂ
ଏବେ ଦେଖାଯାଉନି?
ନା ଏବେ ଦେଖାଯାଉଛି
ନା ମ୍ୟାମ୍ नहीं
Insert.
देखा ଯାଉଛେ ଯେ
ସେ ଖାଲି ହଁ ହଁ ସେଇଠି ଦେଖ ଏଠି କ୍ଲିକ୍ କଲେ ହବ it is visible
ନା ମ୍ୟାମ୍ ଦେଖା नहीं ଯାଉଛେ
ହଁ ଓକେ ଓକେ ଏବେ ଦେଖାଯିବ ଦେଖ share option share your screen sorry stop sharing ମାରନି stop sharing ହେଲେ ତ ବନ୍ଦ ହେଇଯିବ ନା केते बढिया ହେଲା ଯେ
मैम देखा जाउछे जे एबे देखा जाउछे हां देखा जाउछे मैम
ओके 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 केमती हो
नेक्स्ट
हाँ ओके
नेक्स्ट मारी देखंतु तांग देखा जाउछी
इट इज विजिबल
हां मैम
okay 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 now we will start okay critical care nursing critical care unit ccu it is otherwise a short form in a ccu are designed to meet the special needs of actually and critically ill patients the delivery of the critical care originated from the need to centralize the specially trained personnel and equipment in a separate area of the hospital to optimize the care of the critical ill and injured patient. No hospital is complete without establishment of the critical care unit. All you understand? Introduction. Critical care unit is a
हाँ
one
मैम
of the unit
हाँ मैम
which is designed to meet the special needs of the clients acutely and chronically. Okay, chronically ill patient or acutely ill patient, they are meet their special needs. The delivery of the critical care organized from the need to centralize specially trained personnel. Okay, nursing personnel who are trained in the critical care unit and also specialized training they are required and equipment in a separate area. All types of equipments are available in the particular patient. Okay, in the hospital to optimize the care. All totally we are made the all standard. Okay, optimize the care of the critically ill patient, injured patients, and no hospital is complete without establishment of the critically care unit. Then we move to definition of the critical care unit. What is the definition of the critical care unit? Critical care unit is a term used to describe as the care of the patients who are extremely ill and whose clinical condition is unstable or potentially unstable. Okay, the patients are very much severely ill patients and their all total systems are unstable all total parameters bp pulse respiration their cardiac parameters and respiratory parameters all total are unstable and whose clinical condition is unstable or potentially unstable. Okay, that patients that term is known as a critical care. Then critical care unit. You all observe that the picture, different picture we are find it. That is mainly the critical units, different cubical critical units ward. It is defined as the unit in which comprehensive care of a critically ill patient which is deemed to recoverable stage is carried means it is defined as a unit which is a provide the comprehensive care. What does mean by comprehensive? Anyone from the group? What
which
is
include
comprehensive?
which
Hmm.
includes physically, mentally, socially, which includes holistic care.
Yes, yes, very good. It include all the parameters and as well as spiritual, mental, social, all total supportive cares we provide. Not only physical but also comprehensively holistic care we provided. Patient is deemed to a recoverable stage is carried out. Then critically ill patient. You observe that the patient in the ICU and side railing and all total tubing are attached. That is a very most critically ill patient. A high risk for acute or a potentially life-threatening health problems. More ill require more intensive and a careful nursing care. Okay. Then next is critical care nursing. It refers to those comprehensive, specialized and individualized nursing care services which are rendered to patients with life-threatening or a potentially life-threatening conditions and their families. Okay, critical care nursing means it refers to the comprehensive, specialized and individualized nursing care services which are rendered to patients with life-threatening or the potentially life-threatening condition and their family counseling also. Then next, critical care nurse. Critical care nurse is a licensed professional nurse who is responsible for ensuring that acutely and critically ill patients and their families receive optimal care. Okay. Then evolution of the critical care nursing. How to it evolve? First is critical care evolved from the historical recognition that the needs of the patient with acute life-threatening illness or injury could be better treated if they were grouped into specific area of the hospital. Okay. Then next is time 1920. Dr. W. Dundee established the first three-bed neurological ICU, John Hopkins Hospital in the Baltimore, USA. Okay, first is a time to 1920. The event is started. Then 1927, first premature infant care center was established in Chicago. 1927. Then World War II, all you know that 1939 to 1945, shock wards established for the resuscitation. When patient is shock condition, the perfusion is not sufficient in the body. At the time, the patient became shock. Shock wards established for the resuscitation purpose. In 1960, nursing shortage forced grouping of the post-operative patients in recovery area to ensure attentive care. It leads to establishment of the recovery rooms in the USA hospital. Okay. Then next, 1947 to 1948, polio epidemic occurs. At that time, polio epidemic resulted in dying of the patient from respiratory paralysis in United States and Europe. These two countries, the respiratory paralysis occurs when it is 1947 to 48 polio epidemic period. In 1950, the use of the mechanical ventilation. 1950, the use of the mechanical ventilation, iron lungs. Just picture, you look at the picture, iron lungs. For treatment of the polio, development of the respiratory care units. At that time also specialized care needed to the patient, so it will be started. Then in 1950, 51, general ICU developed for a sick and a post-operative patients. In 1960, the critical care developed as a specialty in the response to improve the patient's
ମ୍ୟାମ୍
outcome. Yes,
ମ୍ୟାମ୍ ଗୋଟେ କଥା କହୁଥିଲି ଯେ ଆଇରନ୍ ଭେଣ୍ଟିଲେଟର ମତଲବ ଏଇଟା ହଉଛି ସେଇ ପୁରା ମୁଟା ବାହାର ରହିବେ ପୁରା ଦେହଟା ଅନ୍ଦର ରହିବେ ହେଇ ଭେଣ୍ଟିଲେଟରଟା ଆଇରନ୍ ଭେଣ୍ଟିଲେଟର ନାଇଁ ମ୍ୟାମ୍?
yes. Yes.
Okay, thank you.
1960, critical care developed as a specialty in response to improve the patient outcome with ICU care. Okay, advancement in the post-operative resuscitation and monitoring, and the surgeon's willingness to perform more ambitious surgical procedure in 1960. Okay, then in 1960 to 1969, most US hospitals had at least one ICU. US hospital started in 1960 to 69. The most US hospitals started at least one ICU in the hospital. In 1970, formation of the Society of the Critical Care Medicine, that is known as a SCCM, means Society of Critical Care Medicine, in Los Angeles, California. In 1986, American Board of Medical Specialties approved a certification of special competency in the critical care for the four primary board: anesthesiology, internal medicine, pediatrics, and a surgery. Okay. Then history between 1990 and present, critical care significantly reduced in the hospital time as well as the cost. Then the development of the new and a complicated surgical procedures such as the transplantation of the liver, lungs, small intestine, and a pancreas created a new and important role for critical care following transplantation. Okay. Then next is the widespread utilization of the non-invasive patient. Okay, widespread utilization of the non-invasive patient monitoring, pharmacological therapy for the critical care patients with a specific organ system failure, reduce the time spent in both critical care and critical care units and health facilities. Then critical care in India. Okay, critical care practices in India have evolved significantly over the past decade, as in the most other developing nations, critical care medicines as a specialty has developed very slowly and recently in India. Then early to mid 1970 development of the coronary care units in India. Okay, 1970 early to mid development of the coronary care units in India. Late 1970 first respiratory care units was developed by Dr. Farooq Udvadia in a two hospital in the Mumbai, a community hospital and a private one, to bring down the mortality of tetanus. Okay. Then the few enthusiastic trained consultants came together in 1992 to discuss the critical care on the common platform, and they formed the National Indian Society of the Critical Care Medicine, ISCCM. It has over 2,000 members today, and 16 city different branches also joined, associate within one. Then postdoctoral PhD, okay, postdoctoral fellowship in the critical care medicine conducted by the National Board of the Examination. Here recently been announced that training of the nurses and technicians and therapists has begun in some isolated foci, but has not evolved into a meaningful training activity. Then the critical care is in India is those at the crossroad of the development. The field is full of a lot of dynamism, opportunity, and challenges. Then evolution of the critical care nursing following the Crimean War, 1854 to 1856. Florence Nightingale, you know that Florence Nightingale described the advantages of the specialized area for the recovery of the post-operative patients. At that time, the evolution started how to we are provide the care to the patients with a specialized environmental sanitation and safe drinking water and all total wound care, okay, of the injured patient. At the time it was started. Then next, to provide appropriate care, nurses needed specialized knowledge and skills, and the care delivered mechanism needed to evolve to support the patient's needs for the continuous monitoring of the treatment, monitoring and treatment. If the patient having a very severely ill, provide appropriate care. What is necessary, that care must be we are provided. Not now unnecessary time is wasted. Okay, nurses needed to specialize at the time. If the patient is admitted in the ICU, CCU, they are also life-threatening condition. At the time, if the nursing personnel have a sufficient knowledge, specialized knowledge in that field, and still also they know everything, and the care delivery mechanism needed to evolve to support the patient need or continuous monitoring and treatment. Then the first intensive care unit emerged in 1950 to provide care to the very ill patients who needed one-to-one care. One to one. Always you know that the ICU patient and the staff ratio is one is to one. One is one from the nurse. Then from this environment, the specialty of the critical care nursing emerged as advances have been made in the medicine and the technology. Patient care has become the more complex. Then classification of the care units. Okay, all total how to classify according to level of the ICU. Classification of the level 1, level 2, level 3. Classification of the critical care units according to level 1, level 2, level 3. If the patient having level 1, monitoring, observation, short-term ventilation is needed. Then if the patient level 2, then monitoring, observation, long-term ventilation is needed. Ventilator care is a long-term needed. If the three care, invasive procedure, hemodialysis, constant support, always patient monitoring under the physician and as well as a all total team of the personnel. That is, they needed intensive care as well as a invasive procedure. Some of the invasive procedure also they needed, and a hemodialysis if needed hemodialysis, and a constant observation and a support is needed. Okay. Then it is also one of the classification according to way of the organization organizing ICU. First is traditional, then second is organ system, then third one is a client syndrome, and fourth one is a clientele. Okay, that is a traditional method. Traditionally, surgical ICU, medicine ICU, medical ICU, pediatric ICU, according to their duty, they are admitted that department. Surgical, if patient is post-operative, surgical ICU is needed. If the medicine patient, then medicine ICU is needed. If the child is in the child, then pediatric ICU needed, like that. That is a traditional ICU. Then organ ICU, if the organ system, that if the patient cardiac department, then cardiac ICU is necessary. If the neurological problem, any type of neurological problem or a brain trauma, any other neurological deficit, then a neuro ICU. Then renal, nephrological or any kidney problem, then renal ICU. And if the patient having respiratory problem, severe, then respiratory ICU, according to organ system. Then client syndrome, burn ICU, trauma ICU, stroke ICU. Then clientele, that is a neonatal ICU, pediatric ICU, gynec ICU. These are all regarding the according to way of the organizing ICU. Classification of the critical care patients. First one is zero level, one, two, three. Zero normal ward care. Then two at the risk of the deteriorating, supporting from the critical care team. Level two, more observation or the intervention, single falling organ or post-operative care patients. They are admitted in that level two. Then patients are level three, advanced respiratory support or the basic respiratory support, and a multi-organ patients are admitted in the level 3. Then next is types of critical care units. Okay, types mainly divided into three, mainly two types: general and specialized. General ICU, they are uh, general ICU, they are medical intensive care unit, MICU. Okay, surgical intensive care unit, that is surgical and intensive care unit, medical surgical ICU. Okay, these are all general. But the specialized neonatal intensive care unit, specialized care nursery unit, pediatric intensive care unit, coronary care unit, cardiac care unit, neurosurgery ICU, burn intensive care unit, then trauma intensive care unit. These are the all total. So many things are there, but the specialized care unit, these are. Then principles of the critical care nursing. Okay, what are the principles? Principles of care unit, you know, na? Hello, hello, students.
Yes, ma'am.
Yes, ma'am.
Visible?
Yes, ma'am. Yes, ma'am.
Uh,
Visible, visible.
Okay, okay, okay. Okay, now principle is very, very important. We are follow these principles, and sometimes question also arises. What are the principle in ICU in your uh, 031 theory paper? What are the principles of ICU? Mainly, the principles of ICU anticipation is one of the principle. Then next is early detection and prompt action. If patient come, we are detect early and prompt action. Okay, collaborative practice, communication, prevention of infection. Any type of infection not enter into the ICU. So prevention of infection. In previous class also we are discussing regarding the prevention of infection and infection control measures in ICU. Okay. Then crisis intervention and stress reduction. These are the principles of ICU. Okay. Then one by one discussion. First is anticipation. Anticipation means one has to recognize the high risk patients and anticipate the requirements, complications, and be prepared to meet any emergency. Okay, any type of emergency, they anticipate that if the patient is admitted in the ICU, CCU, or any specialized coronary care unit, then they anticipate that all total all total requirements, any complication arise, that must be a combat. Okay, be prepared to meet any emergency. Unit is properly organized in which all necessary equipment and supplies are mandatory for smooth running of the unit. Everything is available in the ICU because ICU is designed in a such a way that meet the needs of the patients, and all resuscitation, all requirements, all types of these patients, they meet their needs. Okay, fulfill their needs. So it is one of the principle in ICU anticipation. Anticipation. Okay. Second principle is early detection and prompt action. Okay, early detection and prompt action. Second principle. The principle means the prognosis of the patient depends on the early detection of the variations, prompt and appropriate action to prevent or combat the complication. Okay, monitoring of the cardiac respiratory functions of the prime importance in assessment. Okay, that is a prognosis. If we detect any complication arises, any patient having any complication, we uh, firstly we detect detection, early detection. If identify the problem, any type of detection is early, then it will be automatically solved, and prompt action will be done. Okay, prompt action, appropriate action to prevent the combat complication, monitoring of the cardiac respiratory function is the prime importance in the assessment. Okay. Then here third principle is collaborative practice. Okay, collaborative practice means critical care which has originated as a technical and technical a technical sub-specialized body of knowledge and has evolved into a comprehensive discipline requiring a very specialized body of knowledge for the physicians and nurses working in the critical care unit. Collaborative practice is more and more warranted for the critical care in more in any other field. Okay, collaboration is highly essential. If the collaboration is not organized, then it will be hamper the ICU patients care. Okay, then nurses specialized knowledge, physicians, nurses working in the collaboratively. Collaborative. Then communication. Communication, that means if the communication is well, highly known, then it will be applied for ICU patients. Intra-professional, interdepartmental, interpersonal communication has a significant importance in the smooth running of unit. Collaborative practice of communication model also is applicable in the care. Then prevention of infection. Okay, any type of infection that must be prevented in the ICU. Critically ill patient requiring intensive care are at greater risk than other patients due to the immunocompromised state which the antibiotic uses and the stress. Invasive lines, mechanical ventilator, prolonged stay, and the severity of the illness and environment of the critical unit itself. Okay. Prevention of infection mainly critical ill patient itself immune compromised state and antibiotic resistance and some of the patients are a stress condition. All total invasive lines are connected in their body. So mechanical ventilator, prolonged stay, severity of the illness, the environment is also very critical. So prevention of infection is one of the important principle. Then point sixth principle is crisis intervention and stress reduction. Okay, crisis, any crisis condition, what type of we counsel the patients and their family members, crisis intervention. Okay, different types of crisis situation, we provide stress reduction process. Okay, then partnership are formulated during the crisis, bonds between the nurses and the patient and the families are stronger during the hospitalization. As patient advocates, nurses assist patients to express fear and identify their grieving pattern, and they provide the avenues for the post positive coping. These six number of principle, that is mainly crisis intervention and stress reduction. Okay. These are the six principles in the ICU. Always you remember the six principle. It is very highly essential, all of you. Okay. Seven C's of the critical care. Seven C's, what are the C? First C is compassion. Second C is communication with the patient and family members. Consideration to patients, relatives, and colleagues, and avoidance of the conflict. Okay. Then comfort. Always we provide to patient comfort and prevention of suffering. Then carefulness, avoidance of the injury. Carefully we handle the patient. Consistently. Consistency means always we support the patient, their family members, counsel the family members. So we then need monitoring constantly, consistently. Then last one is the closure. Closure, ethics and withdrawal of the care. These are all C's, seven C's we apply in the CCU patients. Okay. Then next is it may be seen that the strange principles do enunciated articulate as the very first requirement in the hospital that it should do the sick no harm. Okay. Yeah, Florence Nightingale, 1900, 1859, say that. Then next is any doubt? Next slide we will next slide I will uh, display. Okay. Only
madam
1 minute. Ah.
ಈ
Me, I would slide. After the how?
ম্যাম এই থ্রি কোশ্চেন প্রিন্সিপাল যেটা কহলে যে কହନ୍ତୁ ଯେ এই কোশ্চেনটা ଆପଣ ମାନେ যে କହିଲେন এই
Slide is
কোଶ୍চেনটা ইম্পর্টেন্ট
visible.
ଅଛି ম্যাম
Slide is visible.
ହଁ
Slide is
ମ୍ୟାମ୍
visible.
ହଁ ଭିଜିବଲ ଭିଜିବଲ
Okay. It is. Set it. Thank you. ପଚାର କଣ କହୁଛ ଗୋଟେ what do you ask? Please ask the question.
क्वेश्चन प्रिंसिपल का जो क्वेश्चन मतलब 6 जो मतलब आपने पढ़ा है अभी वो प्रिंसिपल जो है वो इम्पोर्टेंट है थियोरी के लिए मैम
Principles of ICU always question arises in the theory paper. So it is very very important you learn. Okay. All total you remember the question. What is the principles of ICU? How to organize? What is the responsibility of the nurses in the ICU? These questions always repeat. Yeah.
ओके मैम
Okay, CCU organization, CCU or ICU organization, how to it's organized. Establishment of critical care unit requires the intelligent planning. Okay, one CCU may not cater to all needs. Okay, any one CCU, one ICU not meet the all the needs of the patients according to organ system. If the patient infant, then we need कौन सा आईसीयू चिल्ड्रन को कौन सा आईसीयू चाहिए
Pediatric ICU.
पेडियाट्रिक आईसीयू ओके
पेडियाट्रिक
हाँ ऐसे ही cater to all needs an institute may plan needs in the multiple units under the separate management by single discipline specialist. That is example medical tissue, surgical tissue, bone tissue, trauma tissue.
ट्रॉमासिटी पेडियाट्रिक
बड़े
सीसीयू
बड़े big hospital having all types of ICU, CCU. Okay, according to their organ problems, organ different organ. If the patient having GI problem, GI operation, then they are under the GI ICU. Okay, then if the patient have surgical condition, surgical CCU or a surgical ICU, according to. Then physical setup, CCU organization and a policies and a staffing norm. Okay, physical CCU organization mainly depends upon the physical setup, policies, different types of policies we introduce, and a staffing norms. Staffing also necessary 1:1, one patient, one staff. Okay, one patient के लिए one staff essential. That is staffing pattern also highly essential. Okay.
हम लोग तो कर रहे हैं 3:1
3:1, one that is sometimes government. You are in a government hospital,
नहीं मैम, प्राइवेट।
प्राइवेट, लेकिन बड़ा बड़ा प्राइवेट आईसीयू में 1:1 ही रहते हैं। कलकत्ता में
नहीं
देखो,
नहीं नहीं रहता है मैम, नहीं 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 रहता है मैम।
नहीं रहते
मतलब
हैं।
नहीं रहते, 3:1 करके ही रहते हैं, 3:1, 2:1, 4:1, कभी कभी तो मतलब 5:1 भी हो जाता है।
हाँ हाँ, ऐसे होता है, लेकिन मोस्ट प्रोबेबली बड़ा बड़ा हॉस्पिटल में तो
थ्री
सब
इज
कुछ।
टू वन रहता है मैम, थ्री इज
हाँ,
टू वन रहता ही है।
1:1 भी रहता है, हम लोग भी देखा है 1:1।
अभी नहीं होता है मैम, अभी नहीं होता है।
अभी नहीं होता है। ओके, बोलो मैनेज्ड। ओके, देन फिजिकल सेटअप क्या क्या है? फिजिकल सेटअप में उसका लोकेशन एंड साइज। ओके, पेशेंट एरिया कौन सा है, एंसिलरी एरिया क्या है, ऑक्सिलरी एरिया, दीज फोर थिंग्स इंक्लूडेड इन द फिजिकल सेटअप। Okay, one by one discussion. Location and site. Location means that must be located, ICU located in the centrally located, the hospital centrally place, the ICU located, easily approachable, anyone easily approachable. Okay, away from the hospital traffic. It must be situated in that place away from the traffic situation, and restricted entry. All total members or visitors not enter the ICU. Only timing is 4 to 5 or 3 to 4. Only that time they got the pass and they enter the patient's bedside. Okay, restricted entry. Then sites super specialty hospitals, that is 10% of the total bed. General hospital 2% of the total bed. Optimum bed 14 beds. Minimum beds 4 beds. This is the size regarding the ICU. Okay. Then next is patient area. Patient area means bed space, nursing monitoring system, and call bell system. Bedside में बेड के पास call bell system, well organized. All you know that. Okay. Wall fixer, hand washing facility, and equipments. All total equipments for one bed के लिए सब कुछ equipments supply, they are previously arranged. Open ICU, that is 100 to 120 square feet open ICU. Cubicle ICU 140 to 180 square feet, and a clear area clear area 15 square feet. hand wall space Hand wall space, that is 1 to 2 feet, and head wall space, then a space between two beds, 5 to 8 feet. These are all 3 oxygen, 2 air, 2 cushion, and 16 power outlets. These are the all wall fixers. Okay, 3 oxygen, the totally fixed wall fixer, and 2 air, the line way 2 airs, their outlet, and a 2 suction, and 16 power outlets. These are the all regarding the patient care area. Then the ICU setup, or देखो some of the model of ICU setup. Cubicle, and middle person is a station of the nursing station. Okay. Then monitoring equipments, resuscitative equipments, supportive equipments, general equipment. Monitoring equipments, what is that?
सर अभी स्मार्ट पैरामीटर मतलब रहता है, मॉनिटरिंग डिजिटल
Oximeter,
मॉनिटरिंग, जो
apparatus, pulse
ऑक्सीमीटर
oximetry,
रहता है,
thermometer.
मतलब
Very
उसमें
good.
सैचुरेशन प्रोफ का
हाँ,
मतलब सब कुछ रहता है,
yeah,
उसमें
yeah.
एक ही चीज रहता है
Okay, 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 okay.
का
Resuscitative equipments means what
मतलब
are the
मतलब
ventilator?
वेंटिलेटर मैकेनिकल
Resuscitative. Anyone.
मैकेनिकल वेंटिलेशन
Yes,
Ambubac.
resuscitative
मेडिसिन का भी
equipment
रहता
or
है,
total
रहता है।
resuscitative equipment. Supportive equipment.
Like ventilator.
Yes, supportive equipment. Dental equipment, all you know that linen, bed, total.
मैम नेटवर्क प्रॉब्लम
Okay, equipments all total equipments required for the ICU. Some of the monitoring equipments you see. Okay, monitoring equipments. ECG machine, ECG monitoring, pulse oximeter. Okay, ECG machine. You observe that. Okay.
मतलब जिसमें सैचुरेशन
Hmm.
मतलब पाल्स, प्रेशर,
Yes.
टेम्परेचर,
Yeah.
मतलब सब कुछ आता है उसी को मतलब हम लोग डिजिटल मॉनिटरिंग कहते हैं, इक्विपमेंट्स कहते हैं।
Yes.
एक पेशेंट का जो वाइटल्स का जरूरी है, इम्पोर्टेंट है, मतलब आईसीयू में जो रहता है हर टाइम कॉन्शियस रहना पड़ता है, लेकिन अगर हम मैनुअल करना जाए तो सब हर टाइम वो नहीं देख सकते हैं, इसलिए ये मॉनिटरिंग का जरूरी है। और इस मशीन में हम लोग हर टाइम हर सेकंड देख सकते हैं पेशेंट का वाइटल्स। तो यही है मॉनिटरिंग का मतलब क्या बोलते हैं, यही है डिजिटल मॉनिटरिंग।
Okay. Okay. Yeah, the monitoring equipments. Then next, manual BP machine. Manually, we are taking the BP, manual
यस
BP,
मैम।
BP machine, digital BP machine. Okay. Then invasive BP monitoring. Okay, this is regarding the invasive BP monitoring. Then next, these are देखो CBP kit, temperature, then skin temperature, pulse oximeter. All you know that these are day to day you also see in the hospital setup, ICU setup. Those who are working in the ICU, they are well known. Okay. Then cardiac output monitor. Then next is peak means different types of ticks. Okay. Chamber pressure monitoring, chamber pressure monitoring, and this is a chamber pressure monitoring. देखो syringe pump, you know ना, in the hospital setup syringe pump,
यस
oxygen
मैम
pump, ABG analysis machine. These are the required equipments in the ICU, specialized in the ICU setup. Then next is resuscitative equipments. Resuscitative defibrillator.
इसमें
Okay,
शॉक दिया जाता है मैम।
लॉक किया जाता है defibrillator, nebulizer machine.
यस
Okay.
मैम
Next is humidifier.
इसमें
Humidifier,
सक्शन किया जाता है
suction, temporary
और टेम्परेचर
pacemaker.
भी आता है।
Pacemaker.
यस मैम
Yeah. Then next equipment for the oxygen administration. Ventilator, all you know that ventilator, oxygen cylinder, and suction, uh, mm, suction
ऑटोमास
oxygen equipment. Laryngoscope, different types of size of laryngoscope. It is used endotracheal tube. It is also different size. available in the ICU according to patients. Okay. If the child 3.5, if the adult 7.5, 8, 8.5, okay, it is use size. Then crash trolley. This one is a crash trolley. Okay. All total emergency medications according to chamber wise they are kept. Okay. This is a crash trolley. Then
वो
it,
होने के टाइम हम लोग एक कैस्ट्रॉल लेके पहुंच जाते हैं
हाँ,
दौड़ दौड़ के
yes. It is set endotracheal intubation set. Okay, endotracheal tube intubation set. It is a total endotracheal intubation set. Then it is all you know the ambu bag. Okay,
यस यस
ambu
मैम
bag. Then supportive equipments. They are mainly vein plumb, the different types of syringes and scalp vein. Okay, these are the tissue bed according to their size, how to they move up or
एक्सरे
down.
मैम ये बेड
Different
साइड में लेके जा सकते हैं पोर्टेबल
side, different wheels are there. According
डायलिसिस
to need, you change the position. Then it is a portable X-ray machine. बेडसाइड में एक्सरे भी वो लोग निकालते हैं. ओके, डायलिसिस इक्विपमेंट. दिस इज ए hemodialysis machine. Okay, dialysis is required in the bedside also. Dialysis equipments are used and dialyze the patient. Cardiac board, bed stands, not here positioning. These are also required. Some of the spinal cord injury patient or some of the patients not the movement is possible. So bed stand also available in the OT ICU patients. Then air mattress. Okay, warmer, drip stand. So all you know that, and a dressing trolley. Okay, different places, different things are arranged. These are the dressing trolley for ICU patients. Sterilizer for the sterilization. Warmer for the patient's room. Autoclaving. These are the process of autoclaving. Okay, sterilization always infection control. So sterilization highly essential. Then it is a refrigerator or if anything's kept in the refrigerator. Then clock also necessary for the patients. So every ICU setup that is a clock is also needed. Then lights in the CCU. Okay, if required lights. Then general equipments. General equipments means Foley's catheter, okay, NG tube, drainage tube, suctioning, Romo bag, then physiotherapy machine, then different types of vein plumb, syringes. These are the general equipments of the ICU. Then ancillary area. Ancillary area means nurses changing area. They are not the dresses changes and they enter into the nursing patient's side. So changing area. Medications and nursing. Medication and nursing area. Isolation area. Pantry area. Okay, that utility area, equipments maintenance, equipment maintenance team, or a maintenance area, or a store room, and a dressing room, doctor's room, nurses changing room area, and a doctor's duty room. These are all auxiliary area. Okay, these areas specified and located nearby ICU. All of you see?
Yes, ma'am.
Then next, medical environment. Okay, medical environment, ventilation 6 to 8 air changes per hour. Then air condition must be air conditioned, temperature 25 to 27. Then 40 to 50% humidity. Okay, this area medical environment must be air conditioned, and the temperature 25 to 27 degree, and 40 to 50% humidity. Then next is lighting, varying degree of the illuminations intensity, 1 to 30 lumens, glare-free, provision of dimmer lights. Then noise must be noise-free, soft and a light music, TV and a clock, walls reflection-free, and a floor mosaic. These are the plan for design medical environment. Medical environment should be ventilation 6 to 8 air changes per hour, noise free, soft light, music, TV, clock, TV and clock, walls reflection free, and a floor mosaic. Lighting varying degree of the illumination, intensity 1 to 30 lumens, glare free, and a provision of the dimmer lights. And air condition must be air conditioned, and temperature 25 to 27, 40 to 50% humidity. Okay, these plants must be included in the medical environment. Then ancillary area, CCU, matron's office. Okay, CCU or matron's office, that must be nearest by ancillary area. Office space and a record room, that must be included the nearby. And telephone facilities, always telephone facilities available. Staff toilet nearby, staff toilet attached, and a staff restroom also available. These are all ancillary area in the ICU, CCU. Then policies, different types of policies included in the ICU. First policy, admission policy, treatment policy, staff standing order, and a discharge policy, quality assurance in ICU. Okay, if the patient is admitted in the ICU, then admission policy must be included. What type of patients admitted in the ICU, what condition they are admitted, what amount they deposited. Okay, admission policy, all documents are checked through checklist. Admission policy. And treatment policy, how, what to treatment, what type of condition. Okay, staff standing order must be protocols, different types of protocol in the ICU, CCU. Staff standing orders also, they are included, different types of standing order they follow. Staff, quality assurance always included in the our hospital setup and the ICU also. Quality assurance means standard. We maintain the standard of care. If the quality not maintained, below quality, the patient is deteriorate. Itself, the patient is very much life-threatening condition. So always we follow the life quality assurance in the ICU. Discharge policy also included. Okay, these are the all policies utilized in the ICU. Then next is admission policy. Okay, admission policy, mainly one by one admission policy. Major operations requiring vital monitoring. Okay, major admission policy, mainly major operations requiring vital monitoring. Trauma, head injury criteria, admission criteria, transplantation patients, and requiring the airway support, artificial ventilation, and hemorrhagic shock patient, electrolyte imbalance patient, then toxemia patients, okay, septicemia patient. These are all life-threatening, critically ill patients. So admission policy included the criteria for admission in the ICU. So these type of patients are admitted in the ICU care. Then treatment policy admission only on recommendation of ICU director. Then a vacant bed is allocated in the original ward for the patient return. 20% beds to be kept vacant for the emergency admission. Continuity of treatment is for view of CCU in charge in the consultation with unit in charge. Following a standard treatment protocol, observation of the silence and registration of the new admission and a discharge. Okay. Then staff standing orders. Staff standing orders joint round at the time of staff change. Instruction and maintenance of intake output chart. Okay, instruction and maintenance of the intake output chart, cleaning and maintenance of the equipments, checking and replacement of the essential drugs, proper maintenance of the records, daily round of the physical physician and ICU of CCU combined to take decision for the change in the treatment. These are all staff standing orders. Then discharge policy. Okay, discharge policy, decision to discharge is taken in consultation with the charge charge parent unit. Then patients who have recovered stable and does not require artificial ventilation can be shifted to intermediate care or HUD. Okay, or any other unit, head of the unit. And patients who are not progressing and the chances of recovery is remote to be discharged for allotting bed demands is accurate. When there is no demand, patient is kept in the ICU till death. Then next is quality assurance. Quality assurance in ICU. Student, quality assurance means high standard and a hygiene and a cleanliness. To maintain the high standard by hygiene and cleanliness. To prevent hospital acquired infection. Proper treatment and disposal of the biomedical waste. Daily maintenance and checking the vital equipments. Priority on patient comfort and home feelings. Exit interview of the patients and relatives to increase the standard and quality care. These are all regarding the quality assurance. Quality assurance in the ICU. Priority on patient comfort. Okay, and home feelings. Patient maybe feels homely feelings. Exit interview of the patients and relatives to increase the standard and quality care. Then staffing norms. Then staffing norms, all you know that staff norms, auxiliary staff, technical staff, medical staff. Staffing mainly staffing nursing staff, medical staff, technical staff, and auxiliary staff. Okay. Director CCU, HOD director CCU. Then they divided into physician 24 hours, ANS, ANS and technical staff, then receptionist, safe officer, safety officers. Okay, safety officer. Then ANS divided in nursing staff 24 hours, supporting staff. Then the technical staff mainly respiratory therapist, physiotherapist, ICU technician, lab technician. Okay, staff officer, Safety officer, mainly biomedical engineer, biomedical technician. Organization of the chart of ICU. HOD, student will, this chart is, you see, HOD, first one is HOD.
Head of
Head of the department.
Head of the department. Then next is
Director CCU,
CCU, director CCU. Then next
physician 24 hours, 24 hours
ANS, ANS divided staff,
intended
हाँ, supporting staff. Then technical,
technical staff, technician वगैरह,
yes, technician.
रिसेप्शनिस्ट जो
Technician deals
एडमिशन और डिस्चार्ज के बारे में जो लोग मतलब रहता है,
yes.
इमरजेंसी सब कुछ के रिसेप्शनिस्ट, सेफ्टी ऑफिसर मतलब कुछ भी क्राइसिस हो जाए, जैसा मतलब अगर फायर वगैरह कुछ भी दिक्कत आ जाए तो इसके लिए जो हर टाइम चारों तरफ से देखना पड़ता है, करंट और सब कुछ,
Yes.
तो ये सेफ्टी ऑफिसर। उसके बाद एएनएस के बाद जो नर्सिंग स्टाफ 24 आवर्स, जो नर्सिंग हम लोग के जैसे नर्सिंग स्टाफ रहते हैं 24 आवर्स, मतलब शिफ्टिंग के हिसाब से। उसके सपोर्टिंग स्टाफ मतलब जो मेन स्टाफ नर्सिंग रहते हैं उसको सपोर्ट करने के लिए कुछ स्टाफ रहता है, जैसे एएनएम कुछ वगैरह ऐसा कुछ इस टाइप का कुछ मतलब। और उसके बाद जो टेक्निकल स्टाफ के जो रेस्पिरेटरी थेरापिस्ट, फिजियोथेरापिस्ट, आईसीयू टेक्नीशियन, लैब टेक्नीशियन, मतलब ये पूरी पेशेंट के ऊपर जो जिसका पैरालाइज्ड हो गया है, कुछ प्रॉब्लम है, मतलब नाभ ठीक से काम नहीं कर रहा है, चेस्ट थेरापी देना पड़ेगा, मतलब उसका रेस्पिरेटरी सिस्टम के लिए कुछ कुछ टाइम पे मतलब चेस्ट थेरापी भी देना पड़ता है। ये फिजियोथेरापिस्ट अलग है। आईसीयू टेक्नीशियन मतलब हम लोग को जो मैकेनिकल वेंटिलेशन हो और इन्वेसिव वेंटिलेटर है और मतलब डिफिब्रिलेटर है, मॉनिटर है, इसका कुछ जो मतलब मैकेनिकल जो भी मशीनरी है उसको देखभाल करने के लिए टेक्नीशियन जरूरी है। उसके बाद जो सेफ्टी के मतलब हम लोग जो सेफ्टी बोलते हैं वो बायोमेडिकल इंजीनियर, मतलब जो हम लोग जो यूज़ करते हैं मतलब जो कांच के मतलब मेडिसिन वगैरह और जो भी है उसको मतलब कैसे रिसाइकल किया जाए, उसका सभी देखना पड़ता है उस सेफ्टी ऑफिसर को। और बायोमेडिकल टेक्नीशियन ऐसा
Biomedical
है मैम।
and biomedical technician. They are deal with
हाँ
how to prevent the waste material and
हाँ,
deal
यस यस
with
मैम।
biomedical waste cases.
BWM, हाँ BWMN के अंदर जो पड़ता है।
Very good, very good. All total uh, organization chart of the ICU. Then
यस
next
मैम।
is staff requiring per shift in the ICU. Okay, 1:1 nurse patient during the day, 1:2 nurse patient during night, 4:5, 4 to 5 nurses per bed, including the reliever, ANS 1. Okay, for the administration मैनेजमेंट वर्क के लिए एक ANS needed है. Then medical staff, medical one physician per 5 bed, consultant CCU 1, senior resident 1, junior resident 1. Okay, all total इतना staff requiring for shift in the CCU ICU. Okay, any doubt student?
नो मैम।
Okay, student, today we will discuss regarding the concept of ICU, principles of ICU, and all total. What are the principles? Anyone from the group? First is anticipation.
मैम आपने मतलब प्रीवियस क्लास में बोले थे कि आपने मतलब डिस्कस करके बोलेंगे हम लोगों के स्टडी मटेरियल के बारे में। मैम कुछ हुआ है बातचीत? अगर
अब
आप
तो
बोलते तो बहुत।
हाँ हाँ हाँ, स्टडी मटेरियल के लिए वो लोग तो एक एक टोटल वो हमारा मॉड्यूल ऑनलाइन में छोड़ते हैं, लेकिन ऑनलाइन मॉड्यूल का प्रॉब्लम है ना, इसीलिए तुम लोग का अभी कॉलेज एक दो दिन के लिए इलेक्शन यहाँ चल रहा है, तो वो ज्यादा प्रॉब्लम है। ठीक है, हम लोग ज्यादा से ज्यादा स्टाफ छुट्टी में है, तो
मैम
हम
मैम एक बात मैं बोल रही हूँ कि
हम्म,
हम लोग जब फॉर्म फिलअप किए थे ना मैम, उस
हम्म,
टाइम पे एक ऑप्शन था, अगर हम लोग स्टडी मटेरियल लेना है अगर सॉफ्ट कॉपी तो इजीली मिल जाएगा, अगर हार्ड कॉपी हम लोगों को लेना है तो हम लोगों को एक्स्ट्रा पेमेंट करना पड़ेगा। तो
तो
हम लोगों ने हार्ड कॉपी के लिए एक्स्ट्रा पेमेंट किए थे, और इसमें भी लिखा था कि 3 महीने के बीच ही हम लोगों को स्टडी मटेरियल हार्ड कॉपी मिल जाएगा अपने घर में। मतलब पोस्टल के जो पोस्टल कर देंगे। तो
हम्म,
क्या हुआ गया मैम कि 3 महीना तो बहुत दिन बीत चुके हैं, और अभी मतलब असेसमेंट भी लिखना है। मतलब अभी तो जुलाई से आप लोगों को भेजना है हम लोगों को, और नवंबर में शायद प्रैक्टिकल होगा, दिसंबर में थ्योरी होगा। अगर हम लोग, ये तो डिस्टेंस कोर्स है मैम, हम लोग अगर नहीं पढ़ाई करेंगे तो कैसे पास होंगे मैम? तो स्टडी मटेरियल जरूरी ना है ना मैम?
सॉल्व कर देंगे, कुछ प्रॉब्लम नहीं है, सब होगा। थोड़ा पेशेंस रखो, वेट करो, तुम्हारा मटेरियल भी तुम्हारे पास जरूर वो।
और जो ई कंटेंट से मैम जो हम लोग पढ़ाई करना कोशिश कर रहे थे, लेकिन जो आप लोग जो पढ़ाई हम लोगों को पढ़ा रहे हैं ना, वो उसमें मतलब कुछ अलग अलग लग रहा है मैम।
हम्म।
मतलब दोनों का मैच नहीं हो रहा है, तो ये थोड़ा कंफ्यूजन है कि नहीं मैम?
हाँ जरूर, तुम्हारे में
आप लोग
तो
मतलब आपने जो डेस्कटॉप में दिखा रहे हैं, ये कितना अच्छे से हम लोग समझ जा रहे हैं, और मतलब लग रहा है बहुत इजी से हो जाएगी, लेकिन हम लोग जो ई कंटेंट जो डाउनलोड किए हैं, उसमें जब हम लोग पढ़ाई करने जा रहे हैं तो थोड़ा बिल्कुल ही अलग अलग लग रहा है, और थोड़ा टफ भी लग रहा है मैम। तो मतलब आप लोग के पास जो बुक है, यही बुक शायद हम लोगों के पास आएंगे ना मैम?
हम्म।
तो मतलब दोनों अलग अलग हो रहा है, और मतलब ऐसे ऐसे असाइनमेंट लिखने में भी बहुत दिक्कत हो रहा है मैम, प्लीज थोड़ा देखिए मैम।
ओके ओके, देखो, इन्फेक्शन कंट्रोल प्रोटोकॉल्स क्या है। इन्फेक्शन कंट्रोल का सम ऑफ द प्रोटोकॉल्स है इन द आईसीयू सीसीयू। व्हाट आर दैट? इन्फेक्शन कंट्रोल का प्रोटोकॉल्स, कुछ आइडिया फ्रॉम एनी ग्रुप पार्टिसिपेंट्स? ओके, इन्फेक्शन कंट्रोल का प्रोटोकॉल्स क्या है? देखो, तुम्हारा बुक में इन्फेक्शन कंट्रोल चैप्टर में दिया है, इन्फेक्शन कंट्रोल प्रोटोकॉल्स मींस सेफ्टी फॉर हेल्थ केयर वर्कर्स। ओके, सेफ्टी फॉर हेल्थ केयर वर्कर्स, प्रिवेंटिंग नीडल स्टिक इंजुरी। फर्स्ट वन इज ए नीडल स्टिक इंजुरी। इसके लिए ये एक प्रोटोकॉल है, इन्फेक्शन कंट्रोल का एक प्रोटोकॉल है, प्रोटोकॉल। ओके, प्रोटोकॉल्स सेफ्टी फॉर हेल्थ केयर वर्कर्स के लिए, प्रिवेंटिंग नीडल स्टिक इंजुरी, यूज यूज वैक्यूटेनर्स डिजाइन with lock to prevent the needle stick injury. And healthcare workers, HCW, healthcare workers are advised never to recap the needle after use. All you know that na, healthcare workers or any healthcare provider are advised to never recap. Recap करना ना चाहिए तो नहीं,
नहीं नहीं नहीं
नहीं,
चाहिए।
नहीं
नहीं।
चाहिए। advice to
और
never.
एक इंजेक्शन देने के बाद ही हम लोग जो सिरिंज वगैरह है वो पेशेंट के वो यूज किया, उसके बाद कैप करने के पहले उसको बांध करना चाहिए।
Yes, yes.
जो निडिल है उसको बांध करना है, उसके बाद जिस बकेट में उसको डालना चाहिए उसमें हम डाल देंगे, मतलब जो व्हाइट कंटेनर रहता है उसको हम डाल देंगे, शार्पनर वगैरह सब कुछ डाल देंगे।
Okay, never to recap the needles after the use, and all serves are disposed of in the disposable sharp container and a puncture-proof container in the nursing station. And safety cannula, auto guard. Okay, safety cannula means bracket में auto guard is being used for all the known seropositive patients. ओके, नॉन सीरो पॉजिटिव पेशेंट के लिए सेफ्टी गार्ड कानूला वी आर यूजिंग। देन सेल्फ रिट्रैक्टिंग lancets, self retracting lancets are being used for monitoring the blood glucose level. Then it is recommended that infection control team should be planned an ongoing post exposure prophylaxis, PEP. Okay, PEP, post exposure prophylaxis program for employees ensure that all occupational exposure are documented, treated immediately, and counsel and follow up the for the period of 6 months for a infection control nurse. This is all about the protocol of preventing needle stick injury in ICU or healthcare professionals. Okay, these are all about these points are following the preventing the needle stick injury. Then second one is a peripheral catheter. Okay, peripheral catheters. Establish the vein prior to disinfection of the site. हम लोग जो साइट में पेरिफेरल कैथेटर यूज करते हैं at that side establish the vein prior to disinfect of the site. करते हैं
वेन
ना?
फ्लो वेन फ्लो जो होता है मतलब चैनल वगैरह।
Yes, yes. Establish the vein prior to disinfection of the site. हम लोग वेन में डालने के बिफोर वी डिसइंफेक्ट द साइट, जो साइट में डालते हैं
स्टेरिलिटी मेंटेन।
sterile maintain. Upper extremity is preferred over a lower extremity. Okay, upper extremity is prepared over the lower extremity. Then next is disinfect and select the site with 70% isopropyl alcohol. In case of immune compromised patients, disinfect the select area using the 3 swabs method with isopropyl alcohol and 10% provident and iodine alternatively, and wait till the it dries. Okay, सूखा तक हम लोग वेट करेंगे. डू नॉट टॉस द साइट आफ्टर डिसइंफेक्टेंट. डिसइंफेक्शन होने के बाद वो साइट को हम लोग नहीं टॉस करना है. डू नॉट टॉस द साइट आफ्टर डिसइंफेक्शन. डू
मैम
नॉट.
ये विजिबल नहीं होगा मैम?
नहीं, ये विजिबल नहीं रहेगा तुम्हारा बुक में जो पॉइंट वाइज दिया है इन्फेक्शन कंट्रोल, ये 31 का 4 यूनिट 4, वो जो BNS-031 का ब्लॉक 4 इन्फेक्शन कंट्रोल में ये सब प्रोटोकॉल है, एक एक प्रोटोकॉल. ओके, प्रोटोकॉल कैसे प्रोटोकॉल है इन्फेक्शन कंट्रोल का, एक एक प्रोटोकॉल है. उसमें डू नॉट रीयूज से vascular access device. Then change the peripheral line every 72 hours of earlier if infected or any sign of the infiltration. If difficulty in establishing access, you may make an exception. Then next is CBC. All you know na CBC?
Complete
CBC.
blood complete blood
Central
count.
venous
Complete blood count.
catheter. Central venous catheter. CVC. CVC. Central venous catheter. Okay.
यस मैम।
सीबीसी का प्रोटोकॉल क्या है? यूज टेफ्लॉन कैथेटर as they are preferred over PVC and a polyethylene catheter. Then use subclavian catheter as they are preferred over the jugular and femoral artery. Okay, use minimum number of the lumens and practice the surgical hand washing prior to procedure. Use maximum barrier precautions, cap, mask, gown, and a sterile gloves. When it is introduced, at that time we use the PPE, that means cap, mask, gown, and a sterile gloves. Okay, this is all about the CBC protocol. Then unit tract
Buccal venous catheter.
यूरिनरी ट्रैक्ट इन्फेक्शन, यूरिनरी ट्रैक्ट इन्फेक्शन के लिए प्रोटोकॉल क्या है? एजुकेट पर्सनल टू करेक्ट टेक्निक्स ऑफ कैथेटर इंसर्शन एंड कैथेटर पीरियडिकली री एजुकेट personnel in the catheter care. Okay, regarding the catheter care, educate the personnel correct use of the techniques used in the catheter insertion and
इसके बारे में जो अभिज्ञ है उसी के द्वारा ये सीबीसी का चैनल किया जाता है, जो
yes,
अभिज्ञ है।
यस ये अलग है, यूरिनरी ट्रैक्ट इन्फेक्शन के लिए प्रोटोकॉल है। सीपीसी का ऑलरेडी 4 पॉइंट्स डिस्कस्ड। ओके, ये यूरिनरी ट्रैक्ट का है। यूरिनरी ट्रैक्ट इन्फेक्शन के लिए कैथेटर हम डालते हैं, वो कैथेटर के लिए एजुकेट पर्सनल इन करेक्ट टेक्निक्स। करेक्ट टेक्निक्स क्या है इंसर्शन का, कैथेटर इंसर्शन का, एंड पीरियडिकली री एजुकेट पर्सनल इन कैथेटर क्या। ओके, हाउ टू prevent infection and how to provide care to the patient during catheterization, and after the catheterization how it will be prevent any type of infection in the catheter through catheter. Catheter only when necessary, condom, catheter drainage, and a suprapubic catheterization and intermittent urethral catheterization can be useful alternates to the indwelling catheterization, and use smaller suitable before catheter consist with a good drainage and to minimize the urethral trauma, and follow procedural hand washing, means surgical or a medical hand washing with antimicrobial soap. The collecting bags should be always be kept below the level of the bladder. Maintain a closed drainage system. Okay, maintain a closed drainage system. It breaks the aseptic techniques, disconnection or the leakage of the procedure. The collecting system should be replaced using antiseptic techniques after disinfecting the catheter tubing junction. Then daily metal care with the providing iodine solution and a daily cleansing with the soap and water does not reduce the incidence of urinary tract infection, and is not routinely recommended. Then indwelling catheter should not be changed, okay, at arbitrary fixed intervals, but should be removed from the as soon as they are not needed. However, you must ensure that perennial hygiene is addressed at least every 8 hours. It is the urinary tract infection protocol. Okay. Then ventilatory associated pneumonia. You know that na? Ventilator associated pneumonia is what you had. Hello students. Hello.
Yes, ma'am.
Hmm. Ventilator associated pneumonia you had na, this completion, this protocol also one of the protocols for infection control. वेंटिलेटर वेंटिलेटर के वेंटिलेटर द्वारा ये जो निमोनिया होता है, वेंटिलेटर एसोसिएटेड निमोनिया, patient kept in the ventilator at that time pneumonia develop. Okay, that is ventilator associated pneumonia. Perform endotracheal intubation. Okay, हम लोग जब भी endotracheal intubation करते हैं, intubation with a sterile technique after procedure hand washing with antimicrobial soap, hand drop and a sterile gloves. Okay, this is one of the protocol. Maintain the patient in a semi-recumbent position, 30° to 45° elevation of the head to head of the bed. Then unless they are contraindication. Then next is avoid gastric over distension. Okay, avoid gastric over distension. Avoid unplanned in extubation and re-intubation. Then use of the cough endotracheal tube with inline or the subglottic suctioning. Maintain an endotracheal cough pressure of at least 20 cm H2 water level. Then remove the condensed water in the patient circulate periodically. Use sterile water in the humidifier. Do not routinely sterilize or the disinfect the internal machinery of mechanical ventilator. This is all about the ventilator associated pneumonia protocol. Isolation protocol क्या है? Isolation protocol बच्चों बोलो. Isolation protocol.
Follow standard precaution for all patients admitted in the
Hmm.
hospital.
To minimize the transmission of the pathogen organism to through from and between the patients and the healthcare workers. Following are given. Hospital guidelines follow standard precautions for all patients admitted to the hospital irrespective of their diagnosis. Okay, all पेशेंट के लिए हॉस्पिटल में जो भी एडमिट हुआ है, all पेशेंट के लिए following mainly standard precautions we are using. Then next is follow the special transmission based precaution. Blood-borne pathogens isolation BBP, then airborne isolation AI, then droplet isolation DI, and a contact isolation CI for the patients having a specific disease. Then next is criteria. Critical care patients requiring isolation are those with active respiratory tuberculosis. Okay, active respiratory tuberculosis, MRSA, hepatitis C, immune compromised patients requiring the reverse barrier nursing. Okay, these are the isolation protocols in the ICU. Protocol for cleaning in the ICU. Okay, CCU. Protocol for cleaning the CCU. Protocol for cleaning the CCU, mainly wearing gloves and masks by the staff is essential. Hand washing with soap and water is mandatory. Daily cleaning is must. Okay, daily cleaning is must. Hands on training have to be given for the recognition or reconstruction of the disinfectant. Measuring cylinder should be used. A logbook for this has to maintained. always logbook is maintained, record maintained by the institution. Then periodically supervisors, housekeeping in charge of the cleaning have to check the infection is done properly. Logbook or also should be checked. And a daily vacuum cleaning and a frequent wet mopping is to be done. Drying, sweeping, and use of the brooms must not be allowed in any of the high risk area. High risk area. And weekend disinfection is to be done for all equipment and beds in a unit. Dead stickers to be attached. No area or the surface must be visible dirty. Okay. And restriction of the visitors in CCU. CCU should be followed. Use of the disposable shoe covers is quite popular in a current times, while change of the footwear were practiced by the some. All use equipment should be cleaned with the disinfectant. And wet mopping. Okay, wet mopping of the area has to be done with a disinfectant. Correct concentration to be reconstituted as per the manufacturing of the guidelines. Then weekend calibration to be done for all equipment and beds in the ward. Okay. And all equipments used on a patient, the ventilator tubing, suctioning tubing, etc. must be disposed of. All एक मिनट हाँ मोर क्लास चलछि डिसिजन रो क्लास चलछि सेते बंद करछि 6टा बेलको क्लास चलछि 6टा पर्यंत क्लास चलछि डिसिजन रो बंद करले Okay, students, all equipment should be used in a patient. The ventilator, tubing, suctioning tubing, etc. must be disposed of. Then all excretion and secretion of the patient should be flushed off. And the python, kidney tray, and a bedpan should be washed with a soap and water and a disinfectant before the reuse. All body and a body fluid spills should be covered with a disinfectant 1% sodium hypochlorite for a 10 minutes before cleaning with the gloves hands with gloves hands. Engineering or a maintenance of the head should be informed immediately in case of cracks, damp walls, leakage, feelings of the patient for the repair, and these are the reservoir for the microorganism. This is all about the protocols of cleaning cleaning CCU. Okay, हम लोग कितना प्रोटोकॉल पढ़े हैं? एक इन्फेक्शन कंट्रोल का प्रोटोकॉल फर्स्ट इज प्रिवेंटिंग needle stick injury. Second one is peripheral catheter. Okay, peripheral catheter. Third one is central venous catheter. CBC. Then urinary tract infection. Okay, urinary tract infection. Then ventilator associated pneumonia. Then isolation protocol. Okay, isolation protocol. Last one is a protocol for the cleaning, CCU. प्रोटोकॉल फॉर क्लीनिंग सीसीयू, सीसीयू कैसे क्लीन होता है, क्या क्या करना है डेली, कौन सा रिकॉर्ड देखना है, पीरियडिकली सुपरवाइज हाउसकीपिंग को कैसे करना है, वैक्यूम कैसे क्लीन करना है, वीकेंड में डिसइंफेक्शन कैसे करना है, ऑल इक्विपमेंट्स कैसे डिजाइन से रखना है। ओके, ये सब टोटल हमारा हो रहा है प्रोटोकॉल्स फॉर क्लीनिंग। एनी डाउट? सीडीसी क्या, सीडीसी क्या फुल फॉर्म?
Central venous catheter.
नो, सेंट्रल फॉर डिजीज कंट्रोल, सीडीसी, सीडीसी, सेंट्रल फॉर डिजीज कंट्रोल। ओके, नोजोकोमियल इन्फेक्शन में क्राइटेरिया इन द क्या क्या है इंटेंसिव केयर यूनिट में, वो सब बुक में है तुम्हारा। एलबी, एलसीबीआई, 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 लैबोरेटरी कन्फर्म ब्लड स्ट्रीम इन्फेक्शन, ये सब शॉर्ट फॉर्म में है। यूटीआई क्या है?
Urinary tract infection.
यूरिनरी ट्रैक्ट इन्फेक्शन। फीवर इसमें मोर देन 38 डिग्री सेंटीग्रेड, अर्जेंसी, फ्रीक्वेंसी, डिस्यूरिया, सुप्राप्यूबिक टेंडरनेस, ये सब क्लिनिकल फीचर। अर्जेंसी, फ्रीक्वेंसी, ओके, डाइसूरिया, सुप्राप्यूबिक टेंडरनेस, देन colony account more than 110 105 organisms per ml, not more than 2 species, continuously turbulence nosocomial infection है difficult। So, और कुछ हैंड वॉशिंग का स्टेप एक एक बच्चे बताओ, पढ़ा है इन्फेक्शन कंट्रोल, स्टेप्स ऑफ हैंड वॉशिंग।
6 step, ma'am.
हाँ
Plum to plum,
हाँ, यस,
Palm
वेरी
to
गुड।
dorsum.
हाँ,
Rubbing palm to palm.
back of finger,
back of finger,
Interlacing.
interlacing,
Knuckles. Thumb rotation. Tip of
thumb
finger.
rotation, back.
वेरी गुड। ऑल बच्चे प्रैक्टिस करते हैं इन द क्लिनिकल।
Yes,
Yes,
ma'am.
ma'am.
आईसीयूसीसी में हम लोग कैसे प्रिवेंट करते हैं नोसोकोमियल इन्फेक्शन का, कुछ पॉइंट बताओ। नोसोकोमियल इन्फेक्शन हाउ टू प्रिवेंट इन द आईसीयूसीसी।
Hand
Fumigation.
washing
हैंड
repeatedly.
वॉशिंग, हाँ,
BMW. Proper maintain.
बीएमडब्ल्यू,
Floor cleaning management.
हम्म, ए आई एच क्या है, ए आई आई एच ए आई,
Healthcare associated infection.
infection, healthcare associated infection.
Infection.
Prevention of the nosocomial bacteremia. Okay, prevention is mainly the nurse's role. You must ensure that following practice in the ICU, CCU. Okay, intravenous and intra-arterial catheter should be inserted under the sterile technique condition. आईसीयू का काम है ना नोजोकोमियल इन्फेक्शन कैसे प्रिवेंट करते हैं। ओके, इंट्रावेनस एंड इंट्रा arterial catheter should be inserted under the strict sterile condition, one point. Then second, aseptic precautions should be taken during the catheter insertion. सभी लोग ये करते हैं ना, नहीं बच्चों?
हाँ करते हैं मैम।
Aseptic precautions should be taken to prevent
Yes,
the
ma'am.
nosocomial infection in the catheter insertion. Then third one is a sterile dressing should cover the insertion site. A sterile dressing. So always we are putting the sterile dressing insertion of the site. Okay. Then the catheter should be secured to prevent in and out movement and tracking of the bacteria into the cannula. Then aseptic techniques should be followed when mixing and adding the drugs. Mixing and adding the drugs, changing the infusion or manipulating the connection or a stop cock. Then it is recommended that central venous tubing be changed every 72 hours. Okay, it is recommended that central venous tubing be changed every 72 hours. 72 hours means कितना दिन?
3 days.
3 days. Okay. Very good. You should check the IV fluid for turbidity and a particulate matter and for leaks or in the system. Intravenous or a flush solution should be discarded after 24 hours of opening the bottle. Then the insertion site should be inspected every shift for any sign of infection such as redness, swelling, exudates, purulence, or the warmth, or any complaint of the pain of client at the insertion site. The next point is peripheral catheter should be changed every 72 hours or more often if there is a complication such as a infiltration or the phlebitis. Okay, these are all prevention of the nosocomial bacteremia in the CCU. These points we will look then the infection not enter the anybody infection. Okay. बच्चों any doubt you ask, नहीं तो हम लोग अभी क्लास को एंड करेंगे। और 10 मिनट 15 मिनट है।
मैम हेलो।
यस यस।
मैम एक्चुअली मेरा एक डाउट था कि मैम मैं दिल्ली रीजनल सेंटर में एडमिशन लिया हूँ।
हाँ हाँ।
ओके मैम। तो
दिल्ली
तो दिल्ली मैम।
हाँ 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 ठीक है।
ओके मैम। तो मेरा मेल आया था कि ऑनलाइन जो थ्योरी क्लासेस होगा वो भुवनेश्वर रीजनल सेंटर ही कंडक्ट करेगा। तो मैम मेरा एक डाउट था कि इसका जो असाइनमेंट होगा वो क्या सेम होगा? मतलब सबके लिए क्या? हाँ, असाइनमेंट क्या सबके लिए सेम होगा जो भुवनेश्वर ऑल स्टूडेंट के लिए मैम?
जो मॉड्यूल में है तुम्हारा जो असाइनमेंट का क्वेश्चन है मॉड्यूल में है ना क्वेश्चन।
ओके मैम।
क्वेश्चन के लिए सभी जो जैसे दिल्ली हो और हरियाणा जो भी सेंटर में राजस्थान सेंटर में जो भी सेंटर में आते हैं वही की है असाइनमेंट।
और मैम जो फाइनल एग्जाम होगा मैम तो वो मेरा कहाँ पर होगा? मतलब कि दिल्ली में होगा या फिर भुवनेश्वर में ट्रांसफर करेगा मैम?
फाइनल एग्जाम थियोरी के लिए हमारा तुम्हारा जो सेंटर है दिल्ली वही
हाँ
सेंटर
मैम।
में तुम्हारा एग्जाम होगा। वो सेंटर अलॉट करेंगे नियरेस्ट आपका घर पास पास जो भी सेंटर
अच्छा,
है, स्कूल कॉलेज, वो सेंटर ले लिए थे।
होता है बाई चांस, तो वो मुझे मेल में मैसेज आ जाएगा ना मैम?
मैसेज आ जाएगा,
ओके
मैसेज
मैम।
आ जाएगा एग्जाम के लिए और फॉर्म फिलअप के लिए बिफोर 15-20 डेज बिफोर वो सब आ जाएगा।
ओके
लेकिन
मैम।
प्रैक्टिकल के लिए आप लोगों को सेंटर भी डिवाइड करेंगे। इफ सेंटर नॉट डिवाइडेड देन you will come definitely Odisha and Berhampur College of Nursing।
ओके ओके मैम।
भुवनेश्वर में करते नहीं है, रीजनल भुवनेश्वर में हमारा सेंटर में करते हैं डीसीसीएन कोर्स का।
ओके मैम।
प्रैक्टिकल के लिए, प्रैक्टिकल तो 1-2 दिन ना, कुछ नहीं।
ओके मैम।
हाँ।
और मैम और एक डाउट था कि मैम जो असाइनमेंट सबमिशन का डेट है, वो जो मेरा असाइनमेंट आया है उसमें 30 जुलाई लास्ट डेट है मैम।
हाँ,
लेकिन सभी स्टूडेंट बोल रहा था कि सितंबर लास्ट डेट है।
हाँ, वो भी चलेगा, कुछ प्रॉब्लम नहीं है। 1-2 महीने यहाँ वहाँ हो जाएगा तो कुछ प्रॉब्लम नहीं होगा। वो
नहीं मैम।
बच्चे बच्चे नहीं
अच्छा।
देते हैं, लास्ट तक देते हैं, तो देने से अच्छा होगा क्योंकि तुम्हारा भी असाइनमेंट का ठीक टाइम में वो देखकर हम लोग मार्क पुट करेंगे।
ओके ओके
स्टडी
मैम।
मटेरियल तो नहीं
अपलोड।
आया ना, इसीलिए तो प्रॉब्लम है असाइनमेंट लिखने में। स्टडी मटेरियल से तो नहीं, वो फोन देख के थोड़ा सा टाइम लग रहा है मैम।
हाँ, 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 ठीक है, ठीक है। लेकिन हम लोग साथ से बात करेंगे, रीजनल से बात करेंगे। ओके।
और मैम जो फाइनल एग्जाम कंडक्ट होगा मैम,
हाँ, हाँ।
वो उसका एक्चुअली मैं भूल गया। क्या क्वेश्चन से पूछना भूल गया। ओके मैम, हो गया मैम। थैंक
फाइनल
यू मैम।
रीजनल ठीक करेंगे क्वेश्चन।
Ma'am, please give your mobile number.
हाँ मैम। मैम जो फाइनल एग्जाम होगा वो क्या सबके लिए क्वेश्चन सेम ही होगा? मतलब मेरा रीजनल सेंटर, भुवनेश्वर का रीजनल सेंटर, सबका क्वेश्चन क्या सेम होगा मैम?
सभी का सेम क्वेश्चन होगा, सेम टाइम में एग्जाम होगा। वो जो
ओके ओके।
प्लेस में होगा, ये सेंट्रली इट इज ऑर्गेनाइज ना, इसीलिए सभी के एक टाइम ही एग्जाम होगा। जो बच्चे नहीं देंगे वो बच्चे फिर दूसरे जुलाई में नहीं देंगे तो वो एग्जाम वो लोग दिसंबर में देंगे, ऐसे होगा। एक पेपर, दो
ओके
पेपर मेरा क्लियर, मैं सब कुछ जानता हूँ। ये दो पेपर देना है, फिर लास्ट में एक पेपर देना है, ऐसे भी होता है।
ओके ओके। थैंक यू मैम।
Give your mobile number.
और मैम एक और बात करना था मैम।
हाँ, हाँ,
कि मैम अगर मुझे भुवनेश्वर रीजनल सेंटर में अगर कुछ काम से कनेक्ट करना होगा, तो मैम मैं क्या आपके नंबर रख सकता हूँ या भुवनेश्वर रीजनल सेंटर की किसी नंबर रख सकता हूँ जो आप प्रोवाइड कर सकते हैं, जो अवेलेबल होगा?
हाँ, 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 जरूर। सर पाणिग्रही सर है ना हमारा हेड, वो भुवनेश्वर का।
Ma'am, please
नो
give
मैम, जो नंबर प्रोवाइड किया गया है वहाँ पे, हमारे जीमेल पे आया है या मैसेज पे आया है,
हाँ,
उससे
हाँ।
हम लोग कनेक्ट नहीं हो पा रहे हैं मैम।
ओहो।
मतलब कि फोन भी कर रहे हो तो कोई आंसर नहीं आ रहा है।
तो हमारे नंबर पे कुछ रखने से भी कुछ प्रॉब्लम नहीं है, लेकिन हम लोग जब भी एग्जाम शेड्यूल आएगा और जो भी हमारा प्रैक्टिकल का शेड्यूल आएगा हम लोग बता देंगे।
ओके मैम, तो मैम आप क्या आपका नंबर शेयर कर सकते हैं?
यस, यस।
थैंक यू मैम। मैम प्लीज आप
his name.
थोड़ा सा बोलेंगे अपना नंबर?
मेरा नाम पी लक्ष्मी बाई,
ओके मैम।
एसोसिएट प्रोफेसर, मेडिकल सर्जिकल।
ओके मैम।
993
993
888 5 8 5 8 नाइन नाइन
5
8 5 times 21।
821।
Yes,
ओके, थैंक यू सो मच मैम।
Repeat again.
welcome।
Ma'am, mobile number, please repeat again.
993, okay, 993 8 5 times 5 8 2 1। लास्ट टू वन 10 डिजिट हुआ
मैम डबल
हाँ
नाइन
हो गया।
9
डबल एट
3 8 8 8 8 8 5 टाइम्स
5
5 नहीं है 5 टाइम्स 8
5 9
8
2 1।
मैं नंबर व्हाट्सएप ग्रुप में शेयर कर देता हूँ।
यस यस
जिसको चाहिए मैं उनका नंबर ले लेता
मैम 9938885921।
नो नो नो
Already
हूँ। 993
number.
फिर 5 टाइम्स 8
8 8 8 8 8 5 टाइम्स लिखो 5
और
टाइम्स
लास्ट में 2 1।
2 1
ओके मैम, थैंक यू मैम।
वेलकम okay okay student today class we are and
थैंक यू मैम।
मैम
গোটা বনিতে মধ্যে সোজে বিক্রি করতে হয় না গোটা বনি তো ওখানে কি জানবি অত ফুলগুলো কি করবো গোটা বাড়ি ফুল কিছু মনে হয় সবজি মনে করে দেন আমার তো আর দরকার নেই ফুলের বিক্রি তো হ্যাঁ আর এগুলো পাচ্ছি কিনতে 3 রকমের জানুয়ারি আছে খাইতে হয়তো অন্য চালাইরা তা বাকিকে খাইতে বেশি ভাবি তোমার দিদি যাই দেখি তো মানে 150 টাকা এটা অন্য ফুল এটা অন্য ফুল এগুলো অন্য এগুলো কত সুন্দর আছে খুব অল্প দিনে বাড়ি টাকা করছে আমি করছি
সময় লাগবে না
রবিবার এনে দিতে এলাম অফিস থেকে পেলাম দিদিকে ভাবি দিতে
সকালে যাওয়াই কথা না কথা আছে যে 4-5 লাগিবা জঙ্গল এটা লাগিবা আর নাগা পোগলা লাগিবা
রাস্তাঘাটে খোলাগুলো লাগবে না টেকনিকে সাইডে লাগবে লাগবে নিশ্চয় ফাঁকা আছে গেট কত বছর যায় কত নাকি
আরে গেটটা আমার হয়ে যাওয়ার কথা ছিল প্রায় 5,000 টাকায় হয়ে যাওয়ার কথা ছিল এরপরে বদমাশি করি ওজন বাড়িবার জন্য চালটা রেখে মাথা পাঠিয়ে দিচ্ছে যে ডিজাইনটা দেখছি সেটা ভালো লাগে দিদি 9,000 টাকা দিলা 2,000 টাকা খুঁজতে পারি ভারী ভারী পাঁচ দিয়েছে চোখ বানাবো তারা কিন্তু যে বেটা ওরা যেগুলো তাই খাইলেন ঘরে দুটা খাইলেন
এটা কি বাড়ি এই সাইড
এটা
ভালো আসলে এই কথা বলতে মানে আমার তো 110 টাকা দিয়ে যায় কিন্তু নেই
এটা এমনিটা ট্রেন কি হয় এটা স্যান্ড স্টিল বানাবো আর এটা
কম দিতে ডলারের দামটা কম ছিল সে হোক কমে হয়ে যাবে বলিকি সে কি করিবি টাকাটা বাড়িবে ঘরে খালি পাঁচ দিতে বা 2000 টাকা বাড়ি দিতে আর শুধু টাকা না সেটা পাঁচ দিতে আমাদের বাজেট খাতা করে দিতে সে ওর সরু আড়ে দিয়ে দিতে সেটা দেওয়া খাই লাগে যারা সেটা বেকার দিই ওরা মজবুতি হবে এবার আমার মজবুতি তোমাকে কই দিলাম বাসের বাতা করি না ওরা বিভাগের করে দেখবে না ডাকাতি করতে আবার লাগানো হয় কুকুরগুলা ঢুকতে বাড়িতে পারবেন বলে লাগানো হয় কম নিল যাও ওখানে 6,000 টাকা কম হয় না 2,000 টাকা
মাটি আছে মানে সে বেকর মানে ঘোড়াগুলা জল দিবেন সে মাটিগুলা দিয়ে দেবে কিন্তু আগে দেখি হচ্ছে ছিল আপনি
हनुमान तो खाली बीच चाहिए ना मैंने कहा उनके बीच ही दे ले आज बड़ा लोग का डाली की कोना 5 की
ये सुना ये हुनु थाईलैंड में बच्चों पाते इमिडिएट आइला हुनु हमारे देश थाईलैंड अच्छा ये 4-5 बच्चे गया बेटा बोले
पार्टी बता ली थी इंसान के साथ रहते दुकान पार्टी बात करती ना उन्हें रोज बड़ा तो पार्टी के खाना खाना
मुझे बिल्कुल में क्यों
जो बाहर से केमिकल का
हाँ सुबह बिल्कुल बिल्कुल ना है
हाँ तो